Accurate medical documentation isn't just about checking boxes. It directly impacts patient care, clinic revenue, and compliance. But with busy schedules, clinicians often struggle to meet the required standards for HCC coding. That's where the MEAT criteria come in, or, as we will call it from now on, MEAT. Your simple guide to ensuring every diagnosis is properly documented for risk adjustment. M for monitoring, tracking a condition's status over time. E for evaluating, reviewing test results and symptoms. A for assessing, determining next steps for treatment or management. T for treating, providing care, such as prescribing medication or recommending lifestyle changes. Every diagnosis must meet these criteria to ensure proper documentation, accurate risk adjustment, and compliance with Medicare guidelines. By the end of this video, you'll understand why precision in documentation isn't just about Medicare audits. It's about delivering better patient care. All right, let's start with a simple MEAT example. So we've got a patient with type 2 diabetes with neuropathy. The good news? Their neuropathy is getting better as blood sugar levels drop. Even better, their A1C has gone from 10.5 to 7.9 after starting insulin 3 months ago, moving in the right direction. Now, what's next? Well, we've ordered a urine microalbumin test to check kidney function, and we're keeping them on 10 units of insulin 3 times a day with meals. Now, if you were documenting this in a real progress note, it wouldn't look like a checklist of MEAT criteria. Instead, it would be something like this. T2DM with neuropathy. Reports improvement in neuropathy symptoms. A 1C now 7.9, down from 10.53 months ago. BMI 32, stable. Denies dizziness, vision changes. No foot ulcers on exam. Ordered urine microalbumin to monitor kidney function. Will continue 10 units insulin 3 times a day with meals. Advised to maintain current diet and exercise plan. But behind the scenes, this note still follows the MEAT framework, just not in a rigid format. Here's how. Monitoring. We noted that the patient's neuropathy symptoms are improving and tracked their A1C over time. We also ordered a urine microalbumin test to keep an eye on kidney function. Evaluating. We assessed the patient's response to insulin and linked the improvement in A1C to the treatment. Assessing, by ordering the urine microalbumin test, we're actively monitoring for any complications. Treating. We confirmed that the patient's medications are appropriately managed and continued insulin at 10 units 3 times a day. We also reinforced the importance of diet and exercise. While doctors don't think in terms of MEAT checklists when documenting, their training on managing conditions naturally aligns with the framework, though gaps in documentation can still occur. So, understanding how MEAT applies to real-world notes helps ensure complete and compliant documentation without disrupting the clinical workflow. Each part of MEAT ensures that care is documented thoroughly and accurately. But even small documentation choices can impact reimbursement. For example, Medicare may not accept unchanged to describe a condition, while stable would be considered valid. Being mindful of these details helps ensure accurate coding and prevents revenue loss for clinics. If the MEAT criteria is not met, a diagnosis may not be valid for risk adjustment, potentially leading to compliance issues and missed RAF score opportunities. Now, let's explore additional examples of MEAT in action. We'll look at 2 scenarios. First, a new diagnosis, and then an established diagnosis. All right, let's talk about new diagnoses and what it takes for them to be compliant. There are 3 key things we need. The diagnosis. Logic for the diagnosis. The plan or the next steps for the patient. Now, the plan and the diagnosis, those are pretty straightforward. The real difference is the logic. Now, let's take this example. Right forearm fracture. So what does that look like? It could be physical exam findings. The right forearm is swollen and tender to palpate, and pronation causes pain. Test results. X-ray, hairline fracture in distal end of right ulna. Now, another example, What's the logic behind diagnosing a laceration due to a bite? Diagnosis isn't just about writing down what the patient says, it's based on clinical evidence. In this case, the reasoning behind the diagnosis is the patient presents with a 10-centimeter laceration on the left forearm with irregular wound edges and surrounding contusions, consistent with a bite wound. The patient's history confirms the injury mechanism, reporting that a person bit them. The wound characteristics and patient history together support the diagnosis of laceration due to bite. The key in both examples is that everything has to be checked and documented. Once we've done this once, we don't have to explain the logic again at the next visit or in future notes. If the second example were documented in a real progress note, it might look something like this. Left forearm laceration, 10 centimeters in length, secondary to bite. No signs of infection at this time. Wound cleaned and dressed. Patient instructed on wound care, signs of infection, and follow-up if symptoms worsen. As we mentioned before, this way of writing can be mapped out to the meet criteria. However, notice that the monitoring part is not applicable in this case, as it is usually used for established diagnosis only, and this is an acute injury. And that brings us to learn more about established diagnosis. What changes when the patient has already been diagnosed with something? For this, we'll revisit the arm fracture example. Once it's documented, it's in the system. For the initial visit or the first diagnosis, the doctor notes would look like this. Right forearm X-ray confirms a hairline fracture at the distal end of the ulna. Patient reports pain and swelling. No signs of deformity or open fracture. Immobilized with a splint. Patient advised to rest and follow up for further evaluation in 1 week. From here on out, we just evaluate it. Is the condition stable, worsening, improving? That's it. Remember not to use unchanged. Medicare doesn't accept that term, as it doesn't accurately reflect the patient's current health status. Other terms may also be problematic, but unchanged is commonly misused. Now, let's see how subsequent documentation would look like in a follow-up visit. Right forearm fracture, distal ulna. Pain and swelling have decreased slightly but still present. X-ray shows fracture site stable, with no signs of new displacement. The fracture is healing as expected. Patient continues with splint and is instructed to follow up in 2 weeks for further monitoring. Referred to physical therapy for range of motion exercises once healed. For something like a broken arm, the minimum required for compliance is to document the logic the first time you see the patient. For example, an X-ray confirms the fracture. But next time, focus on the patient's progress. Is it healing, staying the same, or getting worse? While this is the minimum Medicare requires, it's recommended that clinicians include any additional documentation that could contribute to treating or managing the condition, as it helps provide a more complete picture of the patient's care. And that's the difference between new and established diagnoses. Now, let's talk about the most common documentation mistakes. Clinicians face intense time pressures, which could lead to errors like missing evaluative statements that explain a condition's status, or forgetting to document the logic behind a new diagnosis. Here's an example. A patient has a new diagnosis of chronic kidney disease. Compliant documentation would require the logic for the diagnosis, such as test results like GFR levels. Specifically, this would require 2 abnormal eGFR results over 3 months apart to prove chronicity. Without this rationale, the diagnosis doesn't meet Medicare's compliance standards. These errors can lead to audits, and if discrepancies are found, they may result in reduced reimbursement or legal penalties. So, what happens when documentation is done right and meets compliance standards? Clinics avoid costly audits, which can result in penalties of millions of dollars, depending on the extent of the documentation errors. Patients receive better care because their conditions are thoroughly monitored and addressed. Clinicians save time and reduce stress, knowing their notes are compliant. Here's a quick example. Incorrect documentation, morbid obesity, continue to diet and exercise. Correct documentation, morbid obesity improving. BMI 42, today down from 44 at last visit. Improved energy levels. Continue diet and exercise plan. referred to nutritionist. We'll discuss medication or bariatric referral if treatment stalls for 1 year. Small changes like this ensure compliance while improving care quality. Let's face it, nobody went into medicine for the paperwork. That's where DoctusTech comes in. At DoctusTech, we make meat compliance simple and seamless. Our mobile app provides clinicians with education and training to ensure diagnoses are accurately documented. Meanwhile, our patient diagnosis assist platform uses AI-powered technology to analyze patient records, suggest potential diagnoses, and flag documentation gaps. Together, our tools streamline workflows and ensure compliance without disrupting your day-to-day operations. This is where our full ecosystem revolutionizes compliance. Real-time documentation support. DoctusTech ensures every note includes the required logic, evaluation, and treatment while flagging any missing meat elements to keep your documentation complete and compliant. Audit protection flags non-compliant entries before submission. For example, if a clinician writes, "morbid obesity, improving," the system would prompt for a missing treatment plan. By reducing errors, DoctusTech protects clinics from audits and helps clinicians focus on patient care rather than paperwork. The result? A comprehensive, efficient process that boosts RAF accuracy and reduces audit risks. At the end of the day, proper documentation protects your clinic, your patients, and your team. And with DoctusTech, you don't have to choose between compliance and patient care. We make both effortless. Want to see how DoctusTech can streamline compliance for your clinic? Get a free demo today.